Hi, this is Barry DeZamba. I am an assistant professor of instruction in the Health Services Administration and Policy Department, teaching in our undergraduate Health Information Management program and our graduate Health Informatics program. In this module, we're going to talk about the population health workforce. Population health is an interdisciplinary, customizable approach that allows health departments to connect practice to policy for change to happen locally. This approach utilizes non-traditional partnerships among different sectors of the community: public health, industry, academia, healthcare, local government entities, etc., to achieve positive health outcomes. How are these roles different from public health? Well, public health provides an opportunity for healthcare systems, agencies, and organizations to work together in order to improve the health outcomes of the communities they serve. Public health works to protect and improve the health of communities through policy recommendations, health education and outreach, and research for disease detection and injury prevention. It can be defined as we as a society do collectively to assure the conditions in which people can be healthy. So again, population health provides the opportunity for all of the different entities to work together to improve the outcomes of the communities. Areas of focus and where information technology intersects. Some examples include chronic diseases such as heart disease and diabetes, obesity, hospital-acquired infections, mental health, behavioral health, substance abuse, including opioid addiction, health disparities such as maternal mortality, state health assessments, and state health improvement plans. And some specific areas of IT can be electronic health records or electronic medical records, patient-reported outcome collection, any type of data collection, applications such as mobile apps, analytics, predictive models, security and cybersecurity, and privacy. Let's take a look at this competency area, policy analysis and development. Somebody who is in the population health workforce would need to apply standard approaches to conduct a policy review or develop policy guidelines. Projects could help participants understand the legislative process, roles, and influences of various stakeholders, draft, revise, or analyze the impact of public health policies. Population health policy analysis and development project examples include the following, such as analyzing the impact of the smoke-free ordinance, establishing guidelines to screen for food insecurity in a clinic, developing and implementing a cost analysis tool for cancer registries, or working with stakeholders to add physical activity guidelines to the National School Lunch Program. And these are just some examples. Now let's look at where informatics fits in for policy analysis. In this particular example, and this is just one of many, we can utilize quantitative or qualitative analyses tools and methodologies. For this particular example, I am looking at an existing case study, and you can go to the link that's at the bottom of this slide and take a look at the actual study. It's a textual analysis for policy informatics. And this was a case of looking at e-petitions. So many of you may be familiar with things like change.org or other types of petitions that are done online. Policy analysts advise people who govern by taking a systematic, objective, and institutionalized approach to improving the art of government. And the methods for this study included natural language processing that we call NLP It's a form of analytics. There was automatic information extraction and categorization of these e-petitions that involved first transforming the unstructured petition text into a structured form so that computers can further process the data to produce useful information. Another part of the methodology included named entity recognition. This is the task of detecting words and phrases from unstructured text that belong to certain classes of interest, such as persons, locations, organizations, times, and numbers. And these buckets or classes, in this case, is very specific to the documents that are being looked at as part of the natural language processing. So in this case, it's e-petitions. If we were looking at comments made on social media, those classes could be different. And this is an important first step for managing large volumes of text. The major approaches for NER are statistical, machine learning, and rule-based dictionary methods. And when we do this type of informatics methodology, there are existing dictionaries as well as the ability to create your own dictionary to do this methodology. And promising results indicate that NLP variables can serve as predictors for advising policymakers. Let's look at a second competency area for the population health workforce, and that would be program evaluation. This is where somebody would evaluate a population health project that is either ongoing or is in development. Projects can help participants gain understanding of the evaluation process. Population health program evaluation project examples can include evaluating a continuous quality improvement program for specimen data collection, evaluating the effectiveness of a perinatal obesity prevention program, analyzing the coordination in emergency response activities for the Zika virus response, or something like assessing the utility of county clinics for sexually transmitted diseases. And now let's take a look at informatics for program evaluation. The value of population health informatics is maximized through the reporting of critical findings and health trends back to the public and private officials and health providers whenever and wherever health decisions must be made. Health officials and policymakers utilize population health information and data to assign resources and develop policies and laws, such as non-smoking laws and school immunization requirements. One example is seen in the decision by a collaboration of health plans to recommend the administration of the HPV vaccine and cover the cost of the immunization based on population health research data. Business intelligence tools, otherwise known as BI, such as Tableau and Power BI from Microsoft, visualize the data and tell the story. And if you're interested in learning more about this type of informatics methodology, please take a look at the link at the bottom of the slide for the source. Informatics resources. Well, right now, we're taking a look at all of the resources that are in this Venn diagram. So a lot of times you hear buzzwords like AI for artificial intelligence. AI really encompasses all of these other conceptual areas, such as machine learning, language processing or natural language processing, and deep learning. And some of the software tools we use are data science tools such as Python, R and RStudio, Tableau, and Microsoft Power BI. And down in the lower left-hand corner, you can see some actual Python code there. And that is from doing natural language processing on text data and doing something called sentiment analysis. So if policy analysts for population health wanted to look at what people are saying, whether it's on a Facebook page, on Twitter, on a community forum, or in any other type of format, they can collect that data using natural language processing. They can take that unstructured data and have Python or RStudio put that into a structured format, and then using various dictionaries and word lists, come up with a sentiment analysis to determine if what people are saying is positive, neutral, or negative in a scientific manner. And the chart that you see on the upper right side, this is one example of a visualization, and this is done in RStudio, and it's using a package called ggplot2, and these are what we call violin plots, and they're really good at being used to visualize data. There are many more types of plots, and if you're interested in learning more, you can Google R, and you can see all of the different visualizations in the gallery.